Dr. Poole.
My lady, before we start our evidence this morning, we need to swear in our interpreters for the duration of our hearings.
Tyngaf o flaen Duw y byddaf yn cyfieithu pob cyfryw beth a yfynir I mi hyd eithaf fy ngallu am dealltwriaeth.
Tyngaf y byddaf yn cyfieithu bob cyfryw beth a ofynir I mi hyd eithaf fy ngallu am dealltwriaeth.
Don't sit down, she can ask you to stand up again.
Chair.
Can you please give us your full name?
My name is Elizabeth Ann Grant.
Okay, I'd like to repeat after me. I swear by Almighty God
I swear by Almighty God
that the evidence I shall give
that the evidence I shall give
shall be the truth,
shall be the truth,
the whole truth,
the whole truth,
and nothing but the
and
truth.
nothing but the truth.
Mr. Grant, I know this is going to be difficult for you. If at any stage you need a break, just say thank you so much for coming to help.
Ms Grant, whilst you give your evidence, could you try and keep your voice up as much as possible so we can hear you, but also because it's being recorded clearly into the microphone? And also, if I ask you a question that isn't clear, which might be possible, then please ask me to repeat it. Ms Grant, you are a representative of COVID-bereaved Families for Justice Cymru, and you've been good enough to provide the inquiry with a statement, which we have at INQ 000412150. You signed that statement on the 21st of February. Are the contents of that statement true to the best of your knowledge and belief?
They are correct, yes.
Ms Grant, COVID-bereaved Families for Justice Cymru has also provided a response to the inquiry's impact questionnaire, which we can find at INQ 000099719. Is that a document with which you're familiar?
It is.
Ms Grant, in due course, I will ask you some questions about COVID-bereaved Families for Justice Cymru Group, which continues to provide great assistance to this inquiry. I would like to start your evidence, though, if I may, by asking some questions about your mother, Betty, who very sadly passed away on the 19th of April 2020 at the age of 86. And may I pass on the inquiry's condolences for your loss.
Thank you.
I understand that your mother and father retired in around 1988, having owned a number of retail businesses.
Semi-retired, yes.
And then in retirement, they moved, I think, from Cornwall to Tynton in South Wales. We understand that your mother suffered with vascular dementia, which was first diagnosed in 2016, and also arthritis, which affected her mobility. But despite those conditions, I understand she was able to lead a very active life. I believe she represented Cornwall and Monmouthshire at bowls in her retirement.
She did.
Now, there came a time when your mother suffered a fall that required her to be admitted to hospital. Is that right?
Yes, that's correct.
I think on the 13th of January 2020, that fall resulted in her sustaining a broken hip, and she was admitted to hospital then. Is that right?
Yes, that's right.
Now, having undergone an operation to repair her hip, your mother was discharged from hospital and placed on a community ward in a community hospital. That was the 28th of January 2020. Is that right?
Correct.
Your mother was then discharged home on the 24th of February 2020. Did there come a time when your mother had to be readmitted to hospital?
Yes, she was readmitted shortly afterwards. She had stopped eating and stopped drinking. My father was getting concerned. He was her main carer and called the ambulance.
I think that was on the 2nd of March when she went back into hospital. Were you aware of any steps that were taken to protect your mother from COVID when she was readmitted to hospital and make sure that she remained infection-free?
Not aware of anything, no.
Was your mother, for example, tested for COVID on her admission to hospital?
No.
After about a week in hospital, we understand that your mother was deemed medically fit and safe for discharge. That was the 10th of March. However, she was not discharged home. Can you tell us why that was?
The hospital insisted on a package of care of 4 times daily, 2 carers, bearing in mind that there were 3 very capable adults at the property to look after her. As COVID struck, sickness and such like of staff, there was no care package to have offered.
And so rather than being discharged home, am I right that your mother was discharged to a community hospital on the 12th of March?
She was.
Are you aware whether your mother was tested for COVID on discharge from hospital or on admission to the community hospital?
She wasn't.
Do you know whether your mother was placed on a non-COVID ward at the community hospital?
The community hospital, to my knowledge, just has 1 large ward.
Were you able to visit your mother when she was in the community hospital?
Yes, yes, I did.
And when you visited your mother, were you aware of the use of PPE?
No.
In the sense that there was no PPE?
No PPE.
Now, upon the country entering lockdown on the 23rd of March, the community hospital was closed for visitors. I understand you were able to speak to your mother the day before that, the 22nd of March, which was also Mother's Day. Is that right?
Yes, they'd restricted visiting, so my father was going in daily prior. But because it was Mother's Day, my brother facilitated a video call to me with her.
Did there come a time when your mother tested positive for COVID in hospital?
Yes.
I think you say in your statement that on the 31st of March, your mother's temperature spiked. She was tested the same day and then returned a positive test the following day, the 1st of April.
Yeah.
That must have come as an awful shock. Were you kept informed of your mother's condition following that positive test?
Unfortunately not, no.
Is it your belief that your mother contracted COVID whilst in hospital?
Yes, without a shadow of a doubt.
And given your mother's vascular dementia, I understand that you, along with your brother and father, were your mother's attorneys under a lasting power of attorney. We understand that attempts were made to have your mother discharged, but that was not permitted, is it right, until she had 12 clear days without a temperature spike?
It was described to us as 10+2 without another spike in temperature. Yeah.
And then on the 17th of April 2020, your mother was eventually discharged.
On my insistence, yes.
And is it right that you travelled from your home in Bath to Chepstow to support your father and help with your mother following her discharge?
I did, yes.
Can you describe to us, was that straightforward, given obviously Bath was in England, Chepstow in Wales and in lockdown?
Messaging was very confusing. To go by the English guidance at the time, you could travel for care, but I had no clue whether that was the same in Wales, so I actually decided to, I mean, nothing would have stopped me, I hasten to add, but I did ring the police 101 and ask for advice.
And what advice were you given by the police?
Very vague. Didn't really know categorically, but if I was stopped, then just to say that was where I was going and for what reason.
What professional support, if any, did your mother receive when she was discharged from hospital?
They did kindly put in place St David's Hospice carers to come and visit, which they did on one occasion.
And having been discharged on the 17th of April, 2 days later, on the 19th of April, your mother tragically passed away.
She did.
Following your mother's passing, I think you had to return to Bath, leaving your father in Tintern. That must have been an incredibly difficult time.
I was very fortunate in as much as the 3 capable adults were my father, my brother and sister-in-law, so I knew he wasn't alone. But I found I had to process what had gone on and what what we'd witnessed. And again, I wasn't 100% sure whether I should remain there because of the regulations or the guidance. So I went back.
Now, I don't want to go into the detail of it all, but as a result of the things that you have raised, you've been engaged in a long course of dealing with the hospital and with the health services in Wales in order to find out some of the answers to the questions that you've posed. Is that right?
That's correct.
Is it right that following your mother's passing, you received medical notes from the community hospital and discovered an incomplete do not attempt cardiopulmonary resuscitation order had been placed on your mother?
Yes.
Would this have been something that your mother wanted or agreed to?
No. I'd actually had a conversation with her in the previous months. A hard conversation, but one I felt to broach. And, you know, she wanted to feel that everybody was going to do everything for her. So she didn't want that against her, no.
And am I right, there was also a note not to transfer your mother to an acute hospital?
That's
Were
correct.
you aware of that at the time?
No, we weren't. There was no communication from the hospital at all.
As regards your mother's funeral arrangements, you say in your statement that you were given a choice of either 10 people to attend a funeral in Lydney, Gloucestershire, or 5 people to attend a funeral in Wales. And I think you opted for a direct funeral and cremation at Lydney, which took place on the 7th of May 2020. Can you tell us who was able to attend your mother's funeral?
A direct funeral, there isn't anybody to attend. We couldn't, as a family, decide who those 10 people would be. So Dad had the final decision, and he decided to do a direct funeral and then have a celebration of her life when the lockdown restrictions had lifted.
And I think you say on the 25th of September 2020 you were able to hold that celebration at your mother's bowls club.
2021.
2021, I'm sorry.
Where she is laid to rest.
Was it as a result of your mother's death and the way in which she contracted COVID and was dealt with in hospital that you came into contact with some of the people via Facebook, I think, that had similar experience of the COVID pandemic in Wales?
A few groups, a few bubble of Facebook groups had popped up, support groups. And it's difficult because I know the statistics are very helpful, but I actually thought at the time that these thousands and thousands of deaths on the dashboard they were desensitising people to the fact that they were actually people, they were loved people. They just had become statistics, numbers. So I actually reached out on a Facebook platform for anybody in Wales that had lost somebody in the hospitals and the health board. And that's when Anna Louise responded. And I think that's where it all sort of started.
And so that's yourself, Anna Louise, Mars, Rees and Sam Smith.
Yes,
I think the 3 of you formed COVID Bereaved Families for Justice Cymru, and that was the 15th of July 2021. Is that right?
Yes.
Now, obviously, it has evolved over time, but I understand that the group represents people from many different backgrounds who have had many varied experiences of the COVID pandemic in Wales. Is that right?
To a point, yes, yes.
The group represents, obviously, as the name would suggest, a number of people who have had different experiences of bereavement.
Yes. Yeah.
Does COVID Bereaved Families for Justice Cymru represent just the bereaved, or does it represent others and provide support to them? So, for example, key workers or public sector workers, or those that have suffered in other ways in the course of the pandemic?
I would say it's specifically bereaved.
Is it right to say that the group has a wide variety of people and experiences upon which it can draw to form views and raise concerns about the COVID pandemic in Wales?
Yes. Lived experiences, yes.
And those lived experiences, they come from people from different parts of Wales?
Yes, north,
And
south,
within,
east, west, yes.
And within the group, there are people whose relatives and loved ones have died at different ages?
Yes.
And it represents people such as Amanda Provis, who we will hear from in a moment, who have suffered bereavement at different stages of the pandemic as well.
That's correct, yes.
Now, plainly, the group was started after some of the first major decisions in the pandemic had been taken by the Welsh Government. And whilst the pandemic was, of course, still raging, what was the primary aim of the group as you saw it when you first started it?
To find answers, truth, accountability, and basically, hopefully with help from the chair, change for the future.
And did your group focus on the decision-making which had been taken by the Welsh Government as it affected Wales? So was your group always Wales-centric?
Yes, yes, definitely.
I would like to ask you next, if I may, a few questions about a number of the issues that your group have very helpfully raised with us, and I understand also have raised with the Welsh Government, arising out of their lived experiences. Now, in terms of raising concerns with the Welsh Government, I think at the time of responding to that impact questionnaire we looked at a moment ago, which was late 2022, the group had had 5 meetings with the First Minister and 2 meetings with the Health Minister and Deputy Chief Medical Officer, Dr. Chris Jones. Is that right?
That's correct.
I think I'm right in saying that since the group was established, you have also had quarterly meetings with the Health Minister and the Deputy CMO. Is that right?
Yes, so they have stopped that now, yes.
When did those meetings stop?
I'm guessing it was the beginning of last year.
Now, at those meetings, the group raised various issues, and I'd just like to address some of those, if I may. Now, hospitals obviously are at the forefront of any pandemic response and appear to be right at the heart of the greatest areas of concerns expressed by members of your group. What is it about hospital care that your members, in general terms, received, or rather their loved ones received, that's given rise to the greatest concern?
Ventilation in hospitals, procurement and use of PPE and the right PPE, transfers on a freedom of information request on my part. There was what I would consider a large number of untested patients that were discharged to community hospitals, to care homes and residential homes. It's that's probably the main, is the PPE, use of the right PPE, ventilation in hospitals.
So PPE, infection control and nosocomial infection. You're no doubt aware that the figures now show that levels of nosocomial infection in hospitals were extremely high across the whole of the United Kingdom. The virus was, to put it bluntly, rampant across the healthcare sector. Is it the view of members of your group that more could and should have been done by way of infection control to stop the spread of the virus through places where their loved ones were most vulnerable?
I have only one answer, definitely.
Is there a sense held on the part of your members that there was a failure to get on top of the spread of the virus generally before it impacted on individual hospitals and also, obviously, care homes?
Yes.
Obviously, related to this is the testing of asymptomatic healthcare workers, which is an issue that is highlighted in the response to the impact questionnaire. And in that impact questionnaire, your group draws attention to the fact that this, again, was not introduced in Wales until late in the day, and they make the point that this was later than in England. This is a big issue for members of your group, is that right?
It is.
I think I'm right in saying, aren't I, that one of the areas in which your campaign has been successful insofar as the Welsh Government is concerned is that you've campaigned successfully for there to be an official inquiry into nosocomial infection in Welsh hospitals. Is that right?
Yes, that's correct.
Now, whilst we're talking about hospitals, do many members of your group raised the issue of the restrictions on their visiting ability to the hospitals where their loved ones were being looked after, and also the general issue, I think, that you've alluded to in your own evidence, about communications with medical staff?
I was going to say that the majority, as I do, felt the restrictions were necessary to stop the spread. But as you say, communication within hospitals to families was just non-existent.
I mean, do many say that they simply didn't receive sufficient detail or the right level of communication, and of course were denied the ability to visit?
Obviously, the visiting came to a head when people weren't allowed in the first wave to be with their loved ones as a final goodbye. And Mum's hospital didn't have any Wi-Fi facilities, so you couldn't have done any video calling. Very lacking in technology in some of the hospitals in Wales.
Is there a feeling amongst members of your group that there was an absence of bereavement support? So a lack of financial support, but also the structures in place to help people come to terms with the loss of their loved ones?
We have over, I think it's 400 members, and not one person has been offered bereavement support.
So it would be right to say that your members feel there's a lot more that could be done in terms of providing that support, so both emotionally, financially, but also in terms of practicalities. So, for example, returning the clothes from someone who's died in hospital. Is that a big issue?
Yes, a lot of people have had issues with the details of things like that, yes. And Mum came home with an item missing, and it matters when you're trying to accept what's gone on.
Of course. Now, we've mentioned care homes. Is it the case that there are a number of people within your organisation who've experienced bereavement of relatives in care homes in Wales?
Yes, there are.
So that is, I assume, a significant cohort, a significant number of people, but also a significant concern for members of your group, is it?
Yes, because you go back to the untested policy that the government had.
If we can just look at a passage from the impact questionnaire, please, INQ 0000099719. And I think we've got page 5 up on the screen. And if we can look at Roman 7 in front of you, we can see there, this is a concern that's raised by your group: transferring patients from ward to ward, hospital to hospital, hospital to home, care homes untested and or with COVID. Welsh Government did not start testing hospital to care home patients until 2 weeks after UK changed guidance.
We want to know why.
And that's a reference there, isn't it, that mandatory testing of all patients prior to discharge to a care home was introduced in England on the 16th of April, but it was not until the 29th of April 2020 that this change in policy was introduced in Wales. That's right.
Yes.
And as you say, you want to know why.
Why?
And these were issues that your organisation was raising with the Welsh Government and the First Minister in meetings in late 2021.
Yes.
And you still want to know why.
Yes.
What role did you understand that the Welsh Government played in this early period, so January to April 2020, as regards care homes?
I watched yesterday. I saw your chronological order of the Welsh Government's performance. And it does sound like they were caught with their trousers down. And when they realised the impact of the virus on Welsh shores, they sat on their hands.
Did members of your group who had suffered bereavement around that time, so this early period, January to April 2020, have experience of pressure being applied to them or the individuals who subsequently died to be transferred from hospital to care homes?
I'm not aware, except the fact that you're dealing with a generation of people, of the elderly and vulnerable, that would have such respect for anybody in authority. They wouldn't have challenged anything that an authority person would advise or say what is happening.
Now, another issue that your group has raised in the context of social restrictions and the use of so-called non-pharmaceutical interventions that were put in place is the issue that you alluded to earlier in your journey from your home to visit your father and mother. So it's the question of borders and the differences in application and impact between Wales and England. Has that been a significant issue in the views of your members?
They are, I think I might be one of 2 or 3 that live in England.
You found it hard, though, did you, to understand what the rules were?
Yes.
Did you feel there was an unnecessary degree of complexity or confusion?
It was tantamount to chaos. But yes, there was confusion. It's very difficult to get, when you're in England, to get any information, or it was difficult to get information of what was happening in Wales.
Another issue raised by your group relates to face masks. And again, if we can just look at the impact questionnaire that I think is still on the screen in front of you, but now we're looking at Roman 8. The point is made there that the Welsh Government mandated the wearing of masks 2 months after the UK Government. Now, that's a reference to the fact that on the 11th of May 2020, the UK Government advised the public to consider wearing face masks in enclosed public spaces, so shops, trains, buses, in order to help reduce the spread of COVID. This guidance later in England became mandatory, but it wasn't until the 11th of September 2020 that all residents in Wales, those over the age of 11, were required to wear face coverings in indoor public spaces. Is that what this point is making?
Yes, it is. Yes.
And is that an area of concern for members of your group? Is that something that you've asked the Welsh Government to explain?
I'm not sure we've actually asked them directly to explain. But again, it's a question of why and what science were they using.
Now, you will have heard, excuse me, reference to so-called super spreader events. Yes. And this is another issue that's been raised by your group, and you have, I understand, raised it with the Welsh Government. Now, in particular, you've asked why the Welsh Government was content to allow the Six Nations rugby match between Wales and Scotland, which was due to be played here in Cardiff in the Principality Stadium, to go ahead on the 14th of March. Now, we know it was eventually cancelled by the Welsh Rugby Union the day before the match, but that was not before 20,000 Scottish rugby fans had arrived in Cardiff. Now, in light of what was known at the time and the approach being taken by other countries, and I referred yesterday in the opening to Scotland advising against gatherings of more than 500 people, is this something that members of your organisation, again, want answers to?
Yes, it's the big picture.
And is your group also campaigning, and do its primary aims also include aspects of hospital, care home, nursing treatment? So, for example, I think you referred to PPE, respirators, ventilators, and so on and so forth for the purposes of health and social care staff. That is a big concern. We've touched on the broad issue of communications between hospitals, but also communications from care homes. That is another issue.
Yes.
And importantly, the whole issue of the arrangements which were then put in place for dealing with loved ones at the end, the way in which again, communications from hospital staff and care homes and the way in which loved ones were buried and had their funerals conducted. That is an important issue for members of your group.
Yes, there's extra layers to the grief of that as well that keeps getting added. Bodies were mislaid. We have members of that experience. We have knowledge of members of staff within a particular health board that was going around into morgues and on ICU, documenting and photography of dying people and of people that were on ventilators, that was later exhibited and made a book out of, which is another layer that adds to what you're trying to cope with. Because you're immediately thinking, is that my mum? Is that, as I say, it's just unnecessary.
And presumably, and not least because, of course, on account of your mother's death, the issue with DNA, cardiopulmonary resuscitation notices being given, end-of-life care is obviously a vital topic for your group. Is that right?
Yes.
Thank you very much, Ms Grant. I know it can't have been easy, but I have no further questions
Okay,
for you.
Thank you, my lady.
Well, thank you very much indeed for helping us. I understand that there was a request for a break. I think, given the distances in this building, I think I'll just stay here. So if anybody from Grieve Cymru needs to go to talk to Mrs Grant, please do. If they don't mind, I'll just stay here. Of course, it's quite an upheaval when I leave. Are you all right, Mrs. Grant? You don't want to talk to anybody from... You sure? Well, I can see you're in good hands. Is the next witness on their way?
My lady, yes, I think...
We don't need a break, Mrs Grant's all right.
oh, she's,
Yeah, she's
taking a break, so
yeah.
we'll just wait for her to come back.
No, we're not having a break. Everything's okay.
I think we're just waiting for the witness to come back to the
Okay,
room,
fine.
My lady, thank you.
Oh, I see what you mean. She had been in the hearing room. I follow. A bit slow this morning. You okay?
Just stay standing.
May I ask you to start by stating your full name, please?
Amanda Jane Provis.
Can I just go to affirm, so if you'll repeat after me.
Okay.
I do solemnly,
I do solemnly,
sincerely and truly
sincerely and truly
declare and affirm
declare and affirm
that the evidence I shall give
that the evidence I shall give
shall be the truth,
shall be the truth,
the whole truth,
the whole truth,
and nothing but the truth.
and nothing but the truth.
Please just say if you need a break or anything. Thank you very much for helping us.
Ms Provis, I think you were in the room a moment ago when I said this, but I will say it again. If you could just try and keep your voice up so that we can hear you, but also so that your evidence can be recorded.
Okay.
If I ask you anything that you don't understand, please ask me to repeat it
Okay.
or rephrase it. And I understand that you give your evidence this morning on behalf of COVID Bereaved Families for Justice Cymru.
Yeah.
You have been good enough to provide a witness statement to the inquiry that's dated the 23rd of February 2024.
Yes.
We have that up on screen. You signed that witness statement. Is it true to the best of your knowledge and belief?
Yes, it is.
Ms Provis, it's my sad task this morning to ask you some questions about your mother and also your grandmother, both of whom you lost to COVID.
Yeah.
May I start by passing on the inquiry's condolences for your loss?
Thank you.
So I may start with some questions about your mother, Christine.
Yeah.
Now, I understand your mother was a retired homemaker and she tragically passed away from COVID on the 7th of April 2020 at the age of just 61.
That's correct.
Now, I understand that your mother had some underlying health conditions. She suffered from diabetes and chronic asthma and COPD. And also in 2002, I think following that COPD diagnosis, she had most of one of her lungs removed.
Yes.
Now, your father is a hospital porter, and am I right that he worked as a hospital porter throughout the pandemic?
Yes, he did, yes.
Do you know what PPE your father was provided with at work at the start of the pandemic?
Yes, nothing at all.
Did there come a time when your father started showing symptoms of COVID?
Yes, that would have been the end of March. He'd gone to work and about half an hour after he'd gone to work, he rang me and said he was on his way home. He had symptoms of anosmia, which is no taste and no smell. Mentioned it to his line manager, and along with a few other porters who had the same symptoms were told to see the doctor in A&E, and the doctor told them to go home and self-isolate.
So it was not only your father, but a few other hospital porters
That's
were
correct.
showing similar symptoms.
Yes, that's correct.
What steps were taken to protect your mother from becoming infected when your father returned home to isolate?
Obviously he told my mother, his symptoms. They both said they were feeling okay. They slept in separate rooms so that my mother, because of her underlying health conditions, wouldn't catch anything from my father.
Did there come a time, though, when your mother began to show symptoms of COVID?
Yes, she did. It'd be, I'd say, about a day or so after my father had been sent home from work.
So I think you say, yes, in your statement that your father took a PCR test on the 2nd of April.
That's correct.
And that was around the same time that your mother started to show symptoms. So again, similar to your father, lack of taste and smell and a cough. Is
Yes.
that right?
Yes, that's correct.
Now, given your mother's underlying health conditions, her showing those symptoms must have been extremely worrying. What did your mother and father do upon your mother showing those symptoms?
So they rang the doctors because obviously you couldn't go and see the doctor face to face. They spoke to the doctor and the doctor said from the symptoms that she has, sounds like that she has COVID, and she was just advised to use her rescue pack, which she had for COPD, which contained antibiotics and her asthma pump and steroids, to use those as and when she needed them, which is what she started straight away.
Given her underlying health conditions, was your mother at any stage advised to go to hospital?
No.
Now, I understand that on the 6th of April, your father, having taken a PCR test, that came back, and that was a positive
That's
test.
correct.
Was it your belief that your father had contracted COVID then whilst working as a hospital porter,
That's correct.
and that he had passed that on to your mother upon his
Yes,
return home?
That's correct. He spoke to the doctor after my mother had passed, and the doctor said, it could have come from him, or they had gone shopping about a week before the lockdown, and it could have come from there. But it is likely that it was brought home by my father.
I think you say in your witness statement that you had a FaceTime call with your parents on the day of your father's positive test, so that's the 6th of April.
That's correct.
And on that FaceTime call, I think you observed that your mother's symptoms had worsened.
Yeah, she'd got up in the morning and she was feeling quite breathless. She said it felt like she'd been for a run, and she's always had asthma. When she used to have asthma attacks, she used to start getting sort of like panicky and feel that way anyway. So my father said, look, you're going to be fine, you're all right. Just try and take your time, sort of breathe slowly, and sort of we get through this. She had a nebulizer at home, which she used. My dad did say to her, look, do you want to go to the hospital? And she said, no. She said, I'm too afraid to go to the hospital. If I haven't got it and it's just a really, really bad flu, then I'm going to end up with it. I don't want to be on my own, she said. So she was too afraid to go to the hospital, but she wasn't advised to go.
And I think it was the following day, so the 7th of April, that you received a telephone call from your father telling you that your mother had tragically passed away. Is that right? Now, you describe
So
in...
the next day?
Yeah, the 7th.
Sorry, Mr. Paul.
Sorry.
You describe in your statement that you suffer with asthma, and because of that, your father was concerned. He didn't want to put you at risk.
That's correct.
And so it was left to your father and brother to wait for the paramedics.
Yeah, my brother also works at the same hospital as my father. He was in work the day that my mother passed away. My father obviously had spoken to myself. He got hold of my brother, and as my brother was in work, he was on a different ward. He's nursing assistant, so he grabbed what PPE was available to him, and he left work and went straight up to my father's then to be with my dad.
Must have been incredibly difficult for you not being able to be with
Yeah, it
them.
broke my heart.
Your mother's funeral, I think, took place on the 30th of April.
That's correct.
Were you able to see your mother before laying her to rest?
No, not at all. We weren't given that option whatsoever.
Was your mother's funeral subject to the restrictions of which we are now only too familiar?
Yes, there was only 10 people allowed, and that was including the vicar.
Ms. Provis, I know this must be very difficult for you, but if I could ask you to just slow down slightly in your answers, just so that we can record all of your evidence, I'm grateful. Were you able to visit your mother there in the weeks thereafter?
No.
Tragically, you also lost your grandmother Maureen to COVID on the 29th of January 2021.
That's correct.
She was 84, I believe, when she passed.
Yes.
Now, although your grandmother suffered from diabetes, arthritis and pancreatitis, she lived an independent life until early 2020, when I think at that time she wanted to move out of her flat and into a nursing home.
That's right.
Now, I think, excuse me, I'm right in saying that as a family, you had concerns about this.
Yes.
Due to what you had heard on the news about COVID.
That's correct.
So, put it bluntly, your concerns were you didn't want her to move into a nursing home.
No, we
because
didn't.
that would put her at risk of
Yes.
infection. So your grandmother therefore continued living in her flat. Did there, though, come a time when she needed to be admitted to hospital?
Yes, she did. So after my mother passed, and it was after the funeral, so it would have been early May, my grandmother had a fall in her flat. She bashed her head, broke her hip and broke her wrist. She already had a lifeline installed in the flat anyway, which she used. Which contacted the ambulance, my father and his brother, and then my father rang me then to help me to with my grandmother to help her get dressed, to maintain her dignity.
When your grandmother was admitted to hospital, were you aware of any steps being taken to protect her from COVID, to make sure that she remained infection-free?
None that I know of.
Were you aware whether your grandmother was tested for COVID on admission?
Not on admission, no, but before she left, she was.
Were you able to visit your grandmother while she was in hospital?
Not initially. She was originally in one hospital and then she was transferred to another one before coming out and being admitted to a nursing home. So I couldn't visit in the first hospital because of the restrictions, but I was allowed in the second hospital to visit her.
And I think, as you just alluded to, then there came a time when your grandmother was discharged from hospital to a care home.
That's correct.
Again, when that happened, were you aware whether your grandmother was tested for COVID prior to discharge or prior to being admitted to a care home?
Yes, she was. She was before discharge and being admitted to the care home. She was tested for COVID and it obviously was negative.
Were you able to visit your grandmother at the care home?
No. Every time we made arrangements to go, which they said we could visit her outside, there was always bad weather. Being in Wales is quite normal. So, no, we weren't able to. The only time I did, I could go and stand not by the window, because we had to be back from the window where she was in the main lounge with other residents. We weren't allowed close up to the window to talk to her. So she really found it difficult to hear what I was saying to her. She said, "Oh, can you come closer?" And they were like, "No, you're not allowed. You've got to stay back from the window." So practically I had to shout into the lounge and it was really difficult. She couldn't hear tidy.
Sorry to ask you again to just make sure you slow down your answers. I know it's incredibly difficult, but your evidence is very important, so it's very important that we are able to record it. So you've described that how you visited your grandmother at the care home. Within the care home, were you aware of any steps that were taken to protect her from COVID, make sure that she remained infection-free?
No.
I think you described in your witness statement that around the middle of January 2021, a number of residents at your grandmother's care home began to develop COVID symptoms, including your grandmother. Is that right?
That's correct, yes.
Were you aware at that stage what steps were taken within the care home to deal with what sounds like an outbreak of COVID?
Yeah, they were all separated and isolated in their own individual rooms.
And I think it was on the 29th of January 2021 that you received the awful news that your grandmother had passed away in the early hours of the morning.
That's correct.
Was anyone able to be with your grandmother in her very last moments?
My uncle, which is my father's brother, he was able to be with her when they knew that she definitely was going to pass. But they wouldn't allow my father not even 5 minutes to say his goodbyes. You know, they could have tested him and put some PPE on him and sent him to the room even for 5 minutes to say goodbye, but they wouldn't let him.
Are you aware whether your grandmother received any treatment between showing signs of having COVID and then sadly passing on the 29th of January?
I know a doctor went there and that's all they were advised was paracetamol for any temperatures that they had, but nothing else.
So there were no attempts made to transfer your grandmother or any other resident, to your knowledge, to a hospital?
That's correct, yeah, no, nothing.
Although I think I'm right in saying that more people were permitted to attend your grandmother's funeral, there were still restrictions. Can you describe the restrictions and how that impacted on you, but also your family?
Yeah, so at that time we were allowed to have bubbles of people. So as my father was on his own, he was part of my household bubble, which included myself, my husband and my 2 children. But in her funeral, everybody was separated, including my father. So he was sat on his own in his own mother's funeral and not sat with us, even though he was part of our bubble.
Was it a result of losing both your mother and grandmother to COVID in the ways that you have just told us, that you became involved with COVID-bereaved Families for Justice Cymru?
That's correct.
Now, as you will understand, this module concerns Welsh Government decision-making, and COVID-bereaved Families for Justice Cymru have raised a number of issues and matters with us, some of which you'll have heard me explore with Miss Grant a moment ago.
Yeah.
Given your own tragic experiences, would I be right to think that you are particularly interested in infection control in care homes, particularly in the first wave of the virus?
Yes, I am.
As well as infection control in care homes, there were also the restrictions that you've spoken about, placed on care homes generally, in terms of trying to keep residents safe. But of course, the terrible consequences that that had on loved ones and relatives of loved ones that wish to visit care homes. That is a concern of yours, but also members of your group, is that right?
That's correct.
And what about the receipt of medical care within care homes? Have some, perhaps a large number of members of your group raised the issue of whether or not their loved ones received proper or adequate medical care when in care homes?
Yes, that's correct.
Now, outside the care sector, have a lot of your members raised the issue of the 111 medical service, so the phone system for receiving medical help?
Yes, that's correct.
Turning to hospitals and the general provision of medical care, what are your main concerns regarding hospitals?
I'm concerned that there wasn't adequate PPE for anybody that worked there, and that if there was adequate PPE, that it wouldn't have been brought home to my mother, and you know, she would have still, hopefully, have still been with us.
And also related the issue of restrictions in visiting and the ability to see loved ones in hospital. Is that another issue?
Yes, it is, yes. We would have liked, you know, the opportunity, excuse me, to visit more than we were allowed because, you know, I barely saw my grandmother. And even in the hospital and in the nursing home, you know, I didn't have the chance to speak to her when she had all her faculties there because due to the diabetes and it not being controlled properly because obviously she wasn't eating and drinking because she was unwell. Then obviously then that started to affect her faculties, so we couldn't see her when she did have her faculties.
And what about palliative care, end-of-life care? Is that an issue which is raised by your members?
It is.
And finally, as we've spoken about, restrictions on funerals and memorial services, is that an issue that concerns you but also members of your group?
Yes, it is.
Ms. Provis, I appreciate this wouldn't have been easy, but I have no further questions for you.
Thank you.
Thank you very much indeed. Would you like to talk to somebody?
No, I'm okay.
Are you sure?
Yeah.
I saw you brought the photographs.
Yeah. Thank you.
I don't know if everybody else is getting cold, but I am getting distinctly chilly again.
My lady, we're due next to hear from Professor Emmanuel Ogbonna. Professor, could you please start by giving us your full name?
Professor Emmanuel Ogbonna.
I swear by Almighty God
I swear by Almighty God
that the evidence I shall give
that the evidence I shall give
shall be the truth,
shall be the truth,
the whole truth,
the whole truth,
and nothing but the truth.
and nothing but the truth.
Professor, thank you for attending today and assisting the inquiry. Whilst you're giving your evidence, if you can please make sure that you keep your voice up so that we can hear you, but also your evidence can be recorded, and that you speak as slowly as you can so that, again, your evidence can be recorded. If I ask you anything that isn't clear, please ask me to repeat it.
Okay.
Now, you were asked by the inquiry to provide a witness statement addressing the work that you carried out as part of the First Minister's Black, Asian and Minority Ethnic COVID-19 Advisory Group. And we can see your witness statement on the screen. You signed that statement on the 8th of October 2023. Are the contents of that statement true to the best of your knowledge and belief?
They are.
Now, we'll come back to your statement and your work with the First Minister's Advisory Group in due course. Could we start there with a few questions about yourself?
Okay.
You are a Professor of Management and Organisation at Cardiff Business School, Cardiff University.
I am.
You joined Cardiff Business School as a lecturer, I think, in 1990, and were appointed to your present professorial position in 2002. Is that right?
It is.
And I understand that your research cuts across the fields of organisation studies, strategy, marketing and human resource management.
They do.
And your recent research interests have been in the areas of organisational culture, equality, diversity and inclusion, and exploring the position of Black, Asian and minority ethnic communities in the labour market. Is that right?
It is.
I think I'm right in saying that you're also a trustee and vice chair of the Race Council Cymru.
Yes, I am.
Can we please briefly explain what the Race Council Cymru is and also your role within it?
Thank you. The Race Council Cymru is one of the major, I would say, charities that look after the interest of Black and minority ethnic people in Wales. Race Council is also the leading charity that looks after the Black Lives Matter movement, and also that looks after the Windrush elders, the Windrush community that have been so badly dealt with by the state. Race Council Cymru is looking after their affairs in Wales.
And am I right that Race Council Cymru, it started in 2010 as a collection of grassroots community groups, but now it is the overarching umbrella body that brings together a range of organisations to combat racial prejudice, discrimination, harassment, victimisation, abuse?
It is.
And it was in your capacity as a member of Race Council Cymru that you joined with others and wrote to Dr Atherton, the Chief Medical Officer for Wales, in April 2020, expressing concerns about the disproportionate impact that the pandemic was having on people from Black, Asian and minority ethnic backgrounds.
Yes.
Right? We can see a copy of that letter. It's INQ 000222867. We can see that at the top right, it's dated the 14th of April. It is marked for the urgent attention of Dr Atherton. If we can go to page 2, we can see that the letter is signed off by Judge Ray Singh, CBE, who is the chairperson of Race Council Cymru.
Yes.
And he has also provided a witness statement to this inquiry. And then below his name, we can see the list of Race Council trustees, and your name is at the top of that list.
Yes.
If we can please go back to the first page and look at the first paragraph on page 1. The letter references in that first paragraph the report from the Intensive Care National Audit and Research Centre, which suggested that 34% of critical care patients in England, Wales and Northern Ireland were from Black, Asian and minority ethnic backgrounds. And as the letter goes on to say, the first 10 doctors to die from COVID-19 were from Black, Asian and minority ethnic groups, and a disproportionate number of nurses and other healthcare workers that have lost their lives have also been from Black, Asian and minority ethnic communities. And then if we zoom out, the letter goes on to request urgent action to be taken to protect the lives and well-being of Black, Asian and minority ethnic communities in Wales. As well as that letter written on behalf of Race Council Cymru, are you also aware that Professor Singhal, in her capacity as the chair of the British Association of Physicians of Indian Origin, wrote to Dr Atherton and Dr Andrew Goodall, who at the time was the chief executive of NHS Wales, raising similar concerns, And if we could please have a copy of Professor Singal's letter. Thank you. It's INQ 000222868. This is dated a few days later, so this is the 17th of April 2020. And if we can look, please, at page 2 of that letter. The words in bold, it calls for urgent action. In particular, it calls for employers to urgently carry out a stratified risk assessment so that healthcare workers on the front line of tackling the pandemic are not unnecessarily put in harm's way. Thank you. As regards the response to the Race Council's letter, your co-authored letter, you say in your witness statement that the First Minister acted promptly, and on the 29th of April, so that's 2 weeks after receipt of the letter, he established the Black, Asian and Minority Ethnic COVID-19 Advisory Group to look into the issues that had been raised in that letter and Professor Singal's letter, and to recommend the necessary courses of action to alleviate those problems.
Yes.
Do you think it should have taken letters like yours and Professor Singal's, or do you think that the Welsh Government ought to have recognised the disproportionate impact of COVID for themselves and taken earlier action?
My understanding was that at the time, the Welsh Government and people within it were themselves becoming as concerned, and that at the time our letter was written, they had come to the same realization and were thinking of what to do. That was my understanding at the time.
Judge Singh was invited to chair the First Minister's advisory group. And if we could please have on screen INQ 000267870. These are the terms of reference for that advisory group. And in the first paragraph, the terms of reference identify the concerns that Race Council Cymru had identified in the letter we've looked at, namely the disproportionate impact of COVID-19 on people from Black, Asian, minority ethnic backgrounds, with consequent adverse health outcomes. And then if we can just zoom out, the aims of the group are then set out in those 4 bullet points. So namely to advise the Welsh Government specifically on any effective measures that could be put in place to quantify and evaluate risks, any avoidable harms and effective risk assessment measures, possible interventions and system remedies, and any other issues required by ministers. Now, as you say in your statement, the group decided that 2 subgroups were required to explore, first, the socio-economic issues that were implicated, and second, the health and social care issues that were involved. And if we can please, in this document, look at page 3 of the terms of reference. These are the terms of reference for the scientific or risk assessment subgroup. Now, that subgroup was co-chaired by Professor Singal and Helen Arthur. Is that right?
Yes.
And that was specifically tasked to come up with a risk assessment tool. If we could please look at page 5 of this document. These are the terms of reference for the socio-economic subgroup, which you were invited to chair, correct?
Yes.
And if we just look at that list of deliverables, including at point 2, proposals for short-term options to minimise any exacerbation of any identified inequalities. Would it be right, Professor, to say that the work of both subgroups was carried out at pace?
Yes.
And commendably, your socio-economic subgroup managed to produce a detailed report in June 2022. 2020, sorry. That's, so within 2 months of being commissioned to produce a report.
Yes.
And I think the risk assessment subgroup also produced a risk assessment tool and presented that to the Welsh Government by mid-May 2020.
Yes.
I'd like to first look at the work of your socio-economic subgroup, if I may.
Okay.
We can see the report, certainly the first page of the report, it's INQ 000068463. And if we could please go to page 29 of that document, we see there the membership of your subgroup. So we can see that the group included representation from Black, Asian, minority ethnic, NHS care workers, Public Health Wales, NHS Wales health boards and trusts, the Equality and Human Rights Commission in Wales, as well as Welsh Government officials. Is that right?
Yes.
Now, before we look at the themes covered by the report and the recommendations that your group made, I'd like to just understand a bit about the methodology that you employed. How did you gather the data that informed your report?
Okay. So because we didn't have the type of time that one may have required to conduct your regular research, what we did was to rely extensively on evidence that was already published. So evidence on the disproportionate outcomes that are already known in terms of employment, in housing, and other areas. We especially relied on the report by the EHRC talking about Wales and the fairness within Wales. But more importantly, we relied on people. We gathered evidence from around 400 people from grassroots communities whom we invited to participate in Zoom sessions and the like. And we were able to have these sessions practically on a daily basis at the time, from memory, inviting different types of people from grassroots ethnic minority communities to come in and talk to us about what was happening to them. So we relied on that lived experience of racism that, in a sense, was identified by those people extensively in our report.
And I think I'm right, aren't I, that a deputy minister attended some of your meetings, and that would have been Jane Hutt.
Yes.
In general terms, how would you describe the Welsh Government's engagement with your group?
The Welsh Government was very engaged. The Deputy Minister and Chief Whip at the time, Jane Hutt, attended. I remember attending many, if not most, of the Zoom calls that we had. And she was able to identify what I describe in my witness statement as some quick wins. So people would be talking about their experiences, and then she would instruct civil servants to look into those, and in a sense was able to remedy some of the problems that were happening on the ground. So, for example, there were cases where people were saying that they weren't being given appropriate PPE in their respective hospitals, and they attributed that to their race and ethnicity, and it was then possible for the deputy minister to instruct the senior civil servants that were on the calls as well, to investigate those and to do something about that. There was also another case I remember of people who were saying that they were being forced to work for so many hours to be able to pay for their visas because of the extra imposition on health and social care workers by the immigration authorities, the Home Office, that the amount of money they needed to pay to be able to have their visas extended, and that was exposing them to additional risks. And I know that because those rules were not devolved to the Welsh Government, the Deputy Minister and Chief Whip was able to negotiate, or to at least to instruct officials to discuss the possibilities of removing those levies, extra levies on people with the government in Westminster. I don't know how successful that was, but in the end, that became something that the Prime Minister announced, that those levies were removed.
So these are issues that are being identified in meetings that the Welsh Government are attending.
Yes.
And not necessarily waiting for the production of your report in June, but these are being actioned whilst that report is still being worked on.
Yes.
Is that right?
Yes.
Now, a number of themes emerge from the report prepared by your group, and I don't propose to discuss all of them. I'd like to just discuss some of the key themes, and then in so doing, look at the recommendations that your group makes, and then look at the response of the Welsh Government. I'd like to start with ethnicity data, or I probably should say lack of ethnicity data. Now, we don't need to go to the page in your report, but it's paragraph 26 starts with the sentence, data on ethnicity across all health and social care services and many other public services is poor. Is this something that you found to be a particular problem in Wales?
Yes.
And one area of concern that you identified is that data on ethnicity is not recorded on death certificates in England and Wales. And you say in the report, the recording of births and deaths is a reserved matter for the UK government. Can you briefly just explain why that was an issue that you specifically identify?
I think if you are looking to have an accurate statistic on death rates, it would be useful to have the ethnicity recorded. If you don't have the ethnicity recorded, you may actually not be accurate in the data that is being put out. So we may not even know how bad the problem we were dealing with was.
And having identified this issue, are you able to say what steps the Welsh Government has taken to address that issue, it being, as you identify, a reserved matter for the UK government?
I know that, again, this was one of the issues that was taken up, and there were discussions with the relevant departments at the Home Office. And I know that there was a group that was looking into that specifically, but I don't know the outcome of that.
Professor, I think I heard about this in a previous module. I think it's not straightforward, is it? I can see the sense in what you're saying if you want to gather data, but I think I heard from another witness in another module that it's not entirely straightforward recording ethnicity on death certificates.
It's very difficult, my lady, because for whatever reason, not everybody feels comfortable, and ethnicity and race are sociological concepts more than they are biological in that sense. So it's not a straightforward thing. But I think one of the reasons it's not straightforward, it's also because people are not always certain about what the data will be used for. Yeah. So they won't shy away from them. But I do agree that they're not.
Thank you.
Another recommendation, so we're still on the question of ethnicity data, another recommendation you make in this area is linking databases to provide better data on different types of mortality, so disaggregated by different protected characteristics, including ethnicity. If we can just look at the Welsh Government response to your report, so it's INQ 000285930. So, as we see on that first page of the response, first published 24th September 2020 and then updated on the 30th of December. If we can please look at page 13 of this report. This is a section of the response dealing with ethnicity data. And the Welsh Government says that it agrees that it's important to use innovative techniques, including data linking, to help improve the quality of data available on the population disaggregated by different characteristics. And they then say they'll explore ways to link data on outcomes to enable this. And to that end, we'll use the Administrative Data Research Unit and the Secure Anonymised Information Linkage, the SAIL data bank. Are you aware of that work, Professor?
There was a group of people that were dedicated to looking at this area of work. You had population specialists that were doing that, and they did report to some of the meetings, some of which I attended, others that I did not. So I was aware that there was a group looking into this at the time.
And are you satisfied with the Welsh Government's response to the concerns about ethnicity data that your report identifies, or is there more that you would like to be done?
I would say that it is an ongoing thing, and that the groups that were identified and that were looking into it at the time were, when I spoke to some of them, I got the impression that they were positive about what the outcome would be in the end. But I have to say I haven't been in contact since then, so I don't know.
My lady, if that's an appropriate
Yes, of
moment
course.
for a break.
I hope you're warned, Professor. We take a break regularly for the benefit of the stenographer and everybody else. And so I shall return at 11:30. All rise.
Professor, another key theme of your report is the significantly higher risk of death involving COVID amongst those of non-white ethnicity. Now, I don't need you to pull this up, but para 33 of your report identifies that the risk of COVID-related death in males and females of black ethnicity is 1.9 times higher than those of white ethnicity, and the risk of COVID-related death for men of Bangladeshi and Pakistani ethnicity is 1.8 times higher than white males. And you go on at paragraph 34 of the report to say that there is a considerable level of anxiety amongst employees about the risks of COVID-19 and the potential additional risk for black, Asian and minority ethnic workers as an at-risk group. And the report explains how this is being addressed by the risk assessment tool that was developed by the risk assessment subgroup. Now, as we touched on earlier, Professor Singhaal's subgroup was specifically tasked with coming up with a risk assessment tool for frontline health and social care workers. And I understand that you were not involved with the work that was done in that area. I would, though, like to ask you some questions, if I may, about the risk assessment tool. Now, Professor Singhaal has produced a witness statement to this module, and if we could please see that, it is INQ 000251934. And at page 3, paragraph 6, Professor Singhaal describes there the first meeting of the risk assessment subgroup that took place on the 5th of May 2020. And then we see in that table, Professor Singhaal sets out the draft risk assessment tool. Now, the way the tool works, as we can see, is that it identifies risk factors such as age, sex, and comorbidities, which includes ethnicity, and allocates each of those a score. And then once a person has added up their score, they can see their own risk. And if we can go over the page to page 4, we can see a score of 0 to 3, low risk, score of 4 to 6, high risk, and a score of 7 or more, very high risk. And then the person concerned can identify the actions that they should take. So, for example, as we see in that table, those at low risk should continue to work following all recommended hygiene and social distancing measures, whereas those at very high risk should work from home if possible. Professor Singhaal explains in her statement, we don't need to see this part of it, how that first draft of the risk assessment tool was submitted to the Welsh Government for consideration and discussion on the 13th of May, and it was then launched on the 26th of May, with a written statement being made to the entire NHS and social care sector in Wales the following day. Now, insofar as you are able to comment, do you believe that the work of the risk assessment subgroup, and in particular the development and rollout of the risk assessment tool, could or should have been earlier?
I think my understanding at the time was that the people worked at pace to try and develop these, and it was actually the first one in the country, as I understood it at the time. It was the quickest one to be developed. Whether they could have developed one earlier, I am not able to say, but I believe they worked extremely hard and were able to develop this as quickly as they could. And in fact, were modifying it as they were going along because they wanted to be sure that it was as accurate a measure and as useful a tool as it could possibly be.
We can see the actual tool at, if we can have this displayed, please, INQ 000023242. And this is a live resource intended to be completed by online by everyone working or volunteering in health and social care. If we can go to the, thank you. That explains there the purpose of the tool. So it operates essentially in the same way as the draft that we've just seen in Professor Singh's witness statement. So again, scores being allocated to certain risk factors, and then depending on an individual score, they know what actions they should take. You make the point in paragraph 34 of your group's report that the risk assessment tool has been developed to be used by all staff, so not just those from Black, Asian and minority ethnic backgrounds. That's right.
Yes.
And in terms of recommendations, one of the recommendations you make in your group's report is to ensure the wide dissemination of the risk assessment tool and encouragement of the use of the tool in settings wider than health and social care.
Yes.
Professor Singhal, but also Jane Hutt, in her witness statement to the inquiry, explains how the risk assessment tool has been widely disseminated and since May 2020 has been expanded to include education, childcare, play work, youth group, further education and also the police. And the tool continues to be used today. So the recommendation you made in your report appears to have been actioned effectively. Would you agree?
I would.
The next key theme I'd like to discuss is the communication of health and social care messages to Black, Asian and minority ethnic communities. And again, you deal with this just to locate us. It's paragraphs 49 to 51 of your report, but I don't need you to go to it. Can you briefly outline some of the issues that you identified in respect of communication of health and social care messages?
I think there was a key barrier in the sense that the language of communication, which is English Welsh, was not that which was spoken by many of the people from ethnic minority communities that we may have wanted to have reached and that were at very high risks. And we wanted to be able to encourage the government and the health care providers to be able to find ways of developing some of these things in different languages, messages in different languages, so that they could be able to communicate those effectively. There was also the issue of the cultural differences and that might impact on the meaning of the messages being communicated and the impact of those messages. And this was where we wanted to be able to use people with lived experience as much as we could to be able to ensure that messages reached the people who were very vulnerable but weren't initially receiving some of those messages.
And I think you say in the report that digital engagement and engagement with community leaders in particular was key. Is that right?
Yes.
And the recommendation your group makes was to develop a clear multi-channel communication strategy for health and social care, which identifies effective channels to disseminate information and includes funding for BAME targeted outreach and consultation activities.
Yes.
If we can please look at the Welsh Government's response. So it's INQ 000285930, and we're looking here at page 18. Reflecting on your group's recommendation, the Welsh Government state that they have formed a cross-government group to develop a communication strategy which includes health and social services, but also wider policy areas to ensure greater joined-up thinking. Are you satisfied with the work carried out to date by the Welsh Government to improve public health and social care messaging?
It is definitely better than it was before. So from that point of view, I would say that there is an incremental progress in this area.
And if we can...
You understand that, do you, Professor? It goes on. Formed a cross-government group to develop a communication strategy. So we're all talking about communications. And then it talks about following recently completed insight work and stakeholder channel mapping. Doesn't sound like a very good communication in itself, does it?
Yes.
Anyway, what does that mean, completed insight work and stakeholder channel mapping as far as you understand it?
My lady, I think this is something for the government to...
Well ducked, Professor.
Professor, if we can please look at, so it's page 19 of this same document, but the second paragraph, so a bit further on. The Welsh Government, in perhaps slightly clearer language, cites the fact that the Test, Trace and Protect programme has developed a Black, Asian and minority ethnic outreach plan. Now, this is obviously written in September 2020 and updated later that year. In your opinion, was the Welsh Government right to hold out the Test, Trace, Protect programme as an example of an accessible public health messaging programme targeting Black, Asian, minority ethnic communities?
Yes, I think there was quite a lot of emphasis on that at the time. And I remember that there was an initiative to engage people from minority ethnic backgrounds to help in reaching the people that needed to be reached at the time. So,
if I can move to another theme, that of security of employment and income. And you make the point in your report, it's paragraph 59, that the Institute for Fiscal Studies, in its analysis for England and Wales, notes in particular that Black, Asian and minority ethnic people are more likely to be employed in shut-down sectors. So, for example, Bangladeshi men are 4 times as likely as white British men to have jobs in shut-down industries. And similarly, Black African and Black Caribbean men are 50% more likely than white British men to be in shut-down sectors. Now, in your report, you note that in relation to key workers and those employed in occupations at higher risk of COVID-19, the analysis of Welsh employees shows that those from Black, Asian and minority ethnic backgrounds are overrepresented in healthcare and social care. Is that right?
yes.
And your report makes a number of recommendations as to how the Welsh Government could mitigate the disproportionate impact of COVID-19 and employment support schemes as well on Black, Asian, minority ethnic people in Wales. One of those recommendations is for the Welsh Government to establish a social partnership-led job matching redeployment scheme across Wales. What has been the Welsh Government's response to this and to other recommendations your group has made in this area?
I know that social partnership is an area that the Welsh Government has been very keen to work on. And at the time, they talked about developing that area, and I believe this is something that has been done and that is being done. Whether that has been enough or was enough at the time to mitigate the risks that were identified, I think it's a different matter. But then the time was limited to be able to judge that. But I know that they were interested in doing that.
I think my understanding is that since your group reported, the Welsh Government has set up 3 regional employment response groups. Are you aware of that?
Not without going back through my notes now, not something I will recall.
If we can just look at the Welsh Government's response again to your report. So it's INQ 000285930. But this time we're looking at the bottom of page 21. Welsh Government explains the aim of, as I've just referred to, these 3 regional employment response groups. Mm-hmm. And then over the page, these groups will focus specifically on the employability issues facing Black, Asian and minority ethnic people. In your view, does the setting up of these response groups go some way to mitigating the disproportionate impact of COVID-19 that you've identified in your report, or is this not enough, or would you like to see something different being done?
I think the number of Black and minority ethnic people that lost out from COVID-19 is very high, and it's very difficult to see how this on its own would have been sufficient to have mitigated that loss.
In the same section of this response, but a bit further down, so page 22 now, in the second paragraph, the Welsh Government refer to the fact that since 2016, there's been someone appointed to a champion role, although now called a Strategic Equality and Diversity Lead, to increase participation of individuals from protected groups onto an apprenticeship. And I believe the current Strategic Equality Diversity Lead was a member of your subgroup. Is that right?
Yes.
And the Welsh Government's response talks about equality, diversity and inclusion strategy and a suite of actions taken in conjunction with work-based learning providers to support Black, Asian, minority ethnic people. Is this something that you have seen actually put in practice since your group reported?
I can't say that I have followed this intimately, no.
I'd like to move to another issue identified in your report, which is issue of living with race inequality in Wales. And you make the point at paragraph 19 of your report that the pandemic has further exposed existing racial inequalities in Wales. And you refer to the Equality and Human Rights Commission 2018 report, Is Wales Fairer?, which made some deeply troubling findings. You highlight some of these in your report, such as the fact that race was a motivating factor in 68% of hate crimes reported and recorded in Wales in 2018-2019. Is that
yes.
right?
Yes.
From your research, and in particular your engagement with people at a grassroots level that we heard about earlier, would it be right to say that higher levels of violence and abuse experienced by some Black, Asian, minority ethnic groups has led to a sense of isolation and loneliness, perhaps a sense of not belonging?
Yes.
And did your research suggest that those feelings of isolation were exacerbated by COVID?
Yes.
Your report also highlights the link between loneliness and mental health problems. And the point is made, paragraph 22 of your report, that mental health provision in Wales is not meeting demand. Is this a particular issue that your group identified in respect of those from Black, Asian, minority ethnic communities in Wales?
Yes. Mental health issues are more likely to be profound they're more likely to be found in ethnic minority communities, and the consequences are more likely to be profound amongst those groups. So it was a particular concern during a pandemic like COVID that would be exacerbated in that sense.
In terms of recommendations, the Welsh Government made a commitment in March 2020 to develop a race equality plan for Wales. Now, the inquiry understands that progress on that work paused in the early months of the pandemic. And unsurprisingly, your report recommends that work on developing that race equality plan should be progressed as a priority.
Yes.
And your report states that the final race equality plan needs to lead to, in your words, substantive and comprehensive race equality strategy for Wales.
Yes.
Now, at the time that the Welsh Government responded to your report in late 2020, what was said is that the aim was to draft a race equality plan to go out to full public consultation by the end of 2020, with a final plan developed by the end of that Senedd term, which would have been May 2021. I think it'd be right that consultation took longer than anticipated.
Yes.
But is it right that by June 2022, the Welsh Government were in a position to publish its Anti-Racist Wales Action Plan?
Yes.
And if we can have up INQ 000227788, there is the first page of that plan. And if we can go to page 6, please. You are described in this plan as the co-chair, along with Dr. Andrew Goodall. Can you briefly explain your role in the production of this plan?
I was invited to co-chair the steering group that led the development of the plan, initially to co-chair with the then permanent secretary, Dame Shan Morgan, and then lately Dr. Andrew Goodall. And we led the group, the permanent secretary, and I led the group that developed the plan.
And if we can have a look, please, page 23 of this plan, which is, I think, the acknowledgement section. Set out on this page is a long list of individuals and groups that provided evidence and insight to help produce the plan. And we see there the third bullet point references the Covid-19 Black, Asian, minority, ethnic, socio-economic and risk assessment subgroups. So they were the two subgroups that we've been talking about earlier. And is it right to say that many of the recommendations that we have looked at from the socio-economic subgroup report have been incorporated into this action plan?
The fundamental basis of the plan is to deal with those recommendations.
And in terms of ensuring that the action plan is actually implemented, am I right in thinking there is an independent accountability group to oversee that?
Yes.
You are the co-lead of this group alongside Dr. Goodall, is that right?
Yes.
And I think as described in an appendix to this action plan, which we don't need to look at, the overarching purpose of that accountability group is to ensure progress towards the purpose of the plan by holding those responsible to account for what they do or don't deliver. Is that right?
Yes.
Does that accountability group meet with members of the Welsh Government?
Yes, there are regular meetings with the Social Justice Minister and bilateral meetings with other ministers of state and also the First Minister as well. And
just taking a step back, if we can, looking at the report that we started looking at, so the report of your socio-economic subgroup, particularly the recommendations in that report, and then the work that was carried out culminating in this anti-racist action plan in June 2022, and obviously in your capacity as the co-lead of the accountability group, is this action plan being delivered in Wales?
It is a work in progress, I think, is the best way for me to describe it. And why do I say that? I say that because it is trying to address a problem that is intractable, one of your classic definitions of a wicked problem, which is racism, and something that has existed for many generations. And it is trying to address it in a way that is very different from the ways in which people have tried to address this in the past. And those ways people tried to address it in the past have failed to deliver any change. So because it is almost novel in its approach, it's the only nation in the world that has tried this, Wales. Because it's almost novel in its approach, it's having to deal with multiple complexities and having to deal with multiple particularities in terms of the constituencies, the stakeholders that are involved. And it's been difficult in some cases to try to reconcile some of those differences, but it is a work in progress in the sense that the people that are doing it are committed to getting it right. The First Minister, the Minister for Social Justice, all the political parties in Wales have signed up to this, and we are, in a sense, fortunate to be able to have that political centrality. And what we are now doing is trying to sell this to the wider populace in Wales, and that is a difficult task, but it's one that we are determined to succeed in.
So it may, as you say, take time, but you have political buy-in, and within this action plan, the structure is there to address the issues that you've identified.
The structure is there to address the fundamental issues, because the fundamental problem is one of disproportionate outcomes that are defined or exacerbated by race and ethnicity. And if we can get that right, then what we will do is to bring ethnic minority people to the same level as everybody else. And there are other problems that other people are experiencing, but we will then all be at the same level experiencing those problems. So those problems may not and are not necessarily going to go away, but at least we shouldn't then have worse outcomes within bad outcomes. So it's to bring everybody to the same level, and then we can all experience the same problem or enjoy the same level of prosperity, whatever that may be.
And in terms of the issues that you've identified in your report and that are identified in the action plan, in your opinion, is Wales in a better or worse position now than it was at the start of the pandemic?
I think Wales is definitely in a better position. Better in the sense that we've at least recognized that racism is institutionalized, and that's the understanding here in Wales and the acceptance here in Wales, something that is not the case in other parts of the country. So from that standpoint, I think we are in a better position to be able to recognize that there may be additional problems that may be linked to race and ethnicity that we would need to take account of if we were ever to be in this type of position in the future. Are we in the position that we will no longer have the problems? That's why I think it's a work in progress. Not at this point, I would not say, but I would hope that if the Anti-Racist Wales Action Plan was to be implemented in full, that we will be in that position in the future. But at this point, we are not.
Thank you, Professor. I don't have any further questions for you.
I think Ms. Heaven may have.
Good morning, Professor Ogbonna. I represent the Covid-19 bereaved Families for Justice Cymru. I want to ask you some questions, please, about the topic of access to PPE and RPE for Black, Asian and minority ethnic health and social care workers, which you've already explained to CTI was an issue that you identified early on. So I'm going to start at the very first briefing of your group to the First Minister for Wales, Mark Drakeford, and Welsh ministers, and this was the COVID-19 core group, which we know happened on the 20th of May, 2020. But before I get that document up, just so that you understand, we can see that you're not at that briefing, but I'm going to see if you can assist us, please. So if we could first get that document up, it's INQ 30221152, please. And I think it's page 3. Okay, if we just look at page 1 there, we can see, as I've said, this is the COVID-19 core group meeting, 20th of May, and as we can see, as I say, you're not present, it's Judge Ray Singh and Professor Singhal who are giving the briefing there on that day. So if we could go to page 3, please. So this is where we start to see the update from your group. And we can see there's a welcoming there. If we look at paragraph 24, we can see there's been an explanation that the group has been working with stakeholders representing BAME, community expert advisors. And then if we go on to page 4, please. I know it's very small there, but we can see at paragraph 25, there is discussion of the terms of reference. Thank you very much. Which you've touched upon. If we look then at 26, we can see some background information as to the two groups that we've heard about. And if we go on to para 27, we can see reference to the risk assessment tool that we've heard about. And then if we go back to the main document, there are a few more general paragraphs. And at the end there, paragraph 31, the First Minister is thanking the group. So what we can see from these minutes, appreciating that you were not there, is that there's no discussion in this meeting, and indeed there's no evidence to suggest that the First Minister for Wales, Mr Drakeford, asked any questions about the lack of PPE and RPE in the hospital setting in Wales, and whether your group had a view on this being a significant risk factor to Black, Asian and minority ethnic health and care workers contracting COVID-19 and indeed dying. Now, if I just set a bit of context before I ask my question, it might be suggested that this is a curious omission because, as we can see, this is the end of May, and by this stage, a number of doctors, nurses and other health and social care workers of Black, Asian and minority ethnic health backgrounds had lost their lives. And of course, we've seen from the letter that your group sent in that you were raising this as a real concern in the context of Wales. And just to note, We know that the first reported death of a health worker in Wales was the 6th of April, and that was Jitendra Rathod, a heart surgeon at University Hospital of Wales. Now, my question is this. You were not at the meeting, but are you surprised that at this very first discussion that your group had with the First Minister for Wales, there was seemingly no mention by the First Minister of Wales of the significant and fundamental issue that many health and social care workers in Wales, including Black, Asian and minority ethnic health and social care workers, simply didn't have access to PPE or RPE, let alone the fact that what they did have wasn't appropriate. So the question is, are you surprised that this didn't come up?
Without presuming to speak for the First Minister, what I would say is that it could well be that he had relied on the briefings he received previously, because I'm not sure whether I mentioned this in my previous answer, that one of the calls we had, one of the Zoom sessions we had, people that work in healthcare and social care, especially some nurses and doctors, were expressing concern that PPEs were not being distributed to them because they were locum workers. And the then Deputy Minister and Chief Whip was on that call, and she instructed the senior civil servants that were on the call to investigate that and to instruct all health authorities to be fair in their distribution of PPEs and to ensure that there was no element of racism within that. So whether they assumed that this is something they had already resolved or not, I don't know. But I'm not able to speak.
Okay. Well, let me move on to the second question then. This is the Welsh Government response, and this is to your report, which we know was June 2020, and the Welsh Government response was December 2020. So this is INQ 30285930, and it's page 11, please. Now, this is the section of the report that deals with the topic of PPE. And I'll come on to it in a minute, but let me just set the context. You've already explained to the Chair and Council to the inquiry that Jane Hutt had heard the complaints about the lack of appropriate PPE firsthand in the Zoom meetings. So the Welsh Government clearly knew there was a problem in Wave 1 around access to PPE and RPE. However, if we look at this official response, and if we just look at it now, effective supplies of suitable quantities of PPE are essential to protect the workforce in conditions where the risk of Covid-19 infection cannot be mitigated in other ways. The report of the socioeconomic subgroup emphasised the need to ensure sufficient PPE was available both now and for the future. And then it goes on to explain some information about action that's being taken. We can see in this official Welsh Government response that there would appear to be no acceptance or recognition from the First Minister for Wales, Mr Drakeford, because he authored and signed this response, that the Welsh Government had fundamentally failed Black, Asian and minority ethnic health and social care workers in Wales in Wave 1 by simply not providing access to any PPE and RPE, let alone appropriately fitting PPE. So it might be suggested that this response therefore is weak and obfuscatory on this issue. Do you think this response from Mr Drakeford on behalf of the Welsh Government on this really serious issue of access to PPE and RPE was adequate, bearing in mind what your group had identified?
I hadn't interpreted it as such, maybe because I was in it and was aware that there were multiple layers. So there was often a problem of implementation, which I think is a key thing in achieving racial equality. The problem with implementation was the problem that was caused by middle and lower level managers doing their own things, which are often very different from what top management may want to do. So my understanding was that when that issue came up, the Deputy Minister was very strong and forthright in instructing the senior civil servants, and they went ahead and wrote to, that was my understanding, to all the healthcare providers, emphasizing their role in this area, and whether or not then they should have included that in this report is a different matter. But
This was the public response from the Welsh Government. It would have been nice to have seen some reflection on PPE, wouldn't it, in there?
perhaps maybe that should have been included in this report to reflect that there was a concern about this and that had been handled. But I didn't author the report, so I'm not able to comment.
Of course. Thank you very much. Those are my questions.
Thank you, Ms Heaven. You're a generous soul, Professor, I think. Thank you very much for your help.
Thank you, my lady.
My lady, we're next going to hear from Professor Debbie Foster. We just need to do some rearranging on the council bench.
Okay.
I do solemnly,
Sincerely and truly,
declare and affirm
that the evidence I shall give
that the evidence I shall give
shall be the truth,
shall be the truth,
the whole truth,
the whole truth,
and nothing but the truth.
and nothing but the truth. Thank you.
Could you commence, please, by giving your full name?
Yes, Deborah Foster, or Debbie Foster, I'm known as.
Thank you. Professor Foster, thank you very much for attending today and for assisting the inquiry. As you give evidence, please remember to keep your voice up, and if you can speak into the microphone, as we have a stenographer who's taking a note for the transcript. You have kindly provided a witness statement for this module. We don't need to look at it at the moment, but it can be found under reference INQ 000274189. It's dated the 16th of January 2024. And can you confirm you signed that statement, please?
Yes, I confirm.
And can you confirm that the contents of that statement are true to the best of your knowledge and belief?
Yes.
Thank you very much. It's right that you are Professor of Employment Relations and Diversity at Cardiff Business School, Cardiff University.
Yes.
And you were asked to provide a witness statement to this module of the inquiry to outline the work you undertook in respect of the report, Locked Out, Liberating Disabled People's Lives and Rights in Wales Beyond Covid-19.
Yes.
And if you're content, that's also known as the Locked Out Report for short.
Yes.
Can we begin then, please, with some questions about how the Locked Out Report came to be produced? Now, whilst you were not an attendee, can you help us with this, please? The Welsh Government's Disability Equality Forum comprises disabled people and representatives from disabled people's organisations across Wales. Is that correct?
That's correct.
The chair throughout the pandemic was Jane Hutt, MS, who is currently the Minister for Social Justice and Chief Whip.
Yes.
Provided to you in advance of giving evidence today were the minutes of a meeting of the forum. If we could have those on screen, please. It's INQ 000281763, and we can see this is dated the 23rd of June 2020. And if we can please go to page 4 and paragraph 3.7 in the middle of the page. The following is noted, the DMCW, which would be Jane Hutt, is that correct?
Yes.
thanked members for their comments and agreed there is a need to consider the impact of COVID-19 on disabled people as a whole, bringing together the different sectors to enhance the work towards recovery. The DMCW suggested issuing a position statement from the Disability Equality Forum in response to the evidence collated by the various organisations across Wales on the impact of COVID-19 on disabled people. And then at the end, we can see this can be used to support discussions and decision-making across government. So in effect then, is that Jane Hutt announcing that work should commence on the production of what then became the locked-out report?
Yes.
And it's right that Jane Hutt asked Rhiann Davies, who is Chief Executive of Disability Wales, and John Luxton, who is a Special Advisor on Disability, to consider the practicalities of producing the report.
Yes.
And it was following that you were approached by Rhiann Davies, because you were known to Disability Wales through your academic work and as someone who had previously served on advisory groups.
Yeah.
Is it significant that the decision of who to appoint as chair was deferred by the Welsh Government to Rhiann Davies?
Yes, I think it is. To allow the forum itself to choose a chair to represent them is quite progressive. It also means that they gave up a certain amount of control. Unlike Professor Ogbonna, who's a colleague of mine at Cardiff Business School, I know that he was approached by the First Minister and the First Minister's office to produce a report, whereas in my case, the choice was given to the forum itself of who they wished to represent them.
Can we return briefly, please, to the forum itself? If we can have your witness statement on screen, please, INQ 000274189. And it's at paragraph 82, which we can see there. And this is in respect of your attendance at the Disability Equality Forum, which we've just discussed. And you say, on reflection, it appears odd that I wasn't invited to DEF meetings while authoring the report and acting as the nominal chair of the SG. Just pausing there for a moment, SG is the steering group,
yes.
Which we'll come back onto in a moment, and its chosen representative. You go on to say, in the absence of any formal mechanism for me to raise matters with relevant officials and ministers connected to the evidence we were gathering, this would at least have been at least a means for me to raise concerns. You then talk about the advantage of this was that no boundaries were imposed when authoring the report. As the chosen representative of disabled people, I was able to build trust and genuinely co-produce it. And you then say the disadvantage was that I had no formal mechanism through which I could communicate concerns about evidence under consideration with decision makers in Welsh Government. Did you query why you hadn't been invited to attend the forum, to your recollection?
No, I didn't officially query it. I mean, as I say, in retrospect, it looks odd that I wasn't included on the forum. I was invited to a meeting to present the findings of the locked-out report when they were first issued, but I think, in retrospect, it would have been good to have had a mechanism through which I could have raised concerns. If it wasn't the Disability Equality Forum, then another means of raising a concern. At the moment, with the Disability Rights Task Force, which I know you haven't come on to yet, I do have a mechanism through which I can raise concerns.
So did you feel then, when you were producing this report, you didn't have such a mechanism?
Yes, I did feel that, although I was aware that John Luxton, because she was the special advisor to the minister, would probably take back any concerns on our behalf. So there was an indirect mechanism.
Just one final comment about this paragraph. You refer to yourself here as the nominal chair. Could you just explain to us what that means, please?
Yes. When I first was approached by Rhiann Davis of Disability Wales, she asked me to chair this steering group and also the report. But as we did the meetings were conducted online because it was during the pandemic. And as we did the meetings, it became apparent to me that I needed time to sit and make lots of notes as people were speaking, particularly about their lived experience, because there was a lot going on in the meetings and they were quite intense. And so chairing the meetings was going to be difficult. On top of that, I felt that it would be a good thing to redistribute power within the meetings to somebody else, rather than just myself if we were genuinely going to co-produce something. Rhiann was an obvious person to nominate, and she was nominated and elected by the rest of the steering group because she also knew all the people on the steering group by name and where they came from, which organisations they represented. And we were really anxious to get a representation of different impairment groups. So, because the pandemic affected different impairment groups in different ways, it was really important that there was some representation within there from those groups. And Rhiann would know who to draw on as we were discussing things. So it worked out a really good partnership. And really, when I say co-production can mean different things in different contexts. And in this context, we were co-producing a report as a group of disabled people. We weren't necessarily co-producing it with Welsh Government, although there were 2 Welsh Government officials helping us to do that by providing evidence.
Just on the topic then of co-production, in terms of your own research expertise and what you seek to bring to the research that you undertake, in your witness statement, and we don't need to bring it up, but you explain disabled people are regarded as active agents in my research, in contrast to traditional expert approaches, where they have often been treated as passive recipients of others' perceptions and decisions, or as lacking capacity. And I think that's something you've just touched on. So can you please expand on how you sought to do that in terms of preparation of the locked-out report?
Yes. I mean, I just saw us all as experts, really. Everybody in the room was bringing something to the report in terms of, we were all going through the pandemic and people were experiencing things there and then in terms of their lived experience. So I was an academic who could put people's words into a format that would be more agreeable potentially to politicians. And I would also bring some skills, some research skills to that job as well as a mainly qualitative researcher. And I just felt that to co-produce something, you needed to draw not just on quantitative evidence, statistics, or even grey literature that was being produced during the pandemic by different organisations and disabled people's organisations. But you also needed to hear voices of people and maybe their members if they were representing a group. And most of the people on the steering group were representing groups like groups with hearing impairments, sight impairments, learning disabilities, for example. And they could then go back to their groups and say, this is what we're discussing within the steering group. Have we got any examples from our membership of things that are happening to people now that need to be brought to the attention of Welsh Government? And we can put those in the report. So the creation of the evidence was ongoing. It was almost live. And that was quite unusual. But there were also ethical restrictions during the pandemic on how you could collect data as an academic anyway. And my university was saying we couldn't go out and interview people formally because there were problems, face-to-face interviews weren't possible, but even online interviews, it could be disruptive. You could be talking to somebody who had a loved one who was ill at the time, and just contacting people at the time was a sensitive issue. So by bringing a group of people together to do this report, who could draw on their own resources, both personal and their group's resources, was really useful.
And you've touched there upon the steering group. It's right that that was set up and chosen, membership was chosen by the Disability Equality Forum.
Yes, it
So there was control over who was in that group. The Welsh Government didn't seek to tell you.
No.
And that steering group met for the first time on the 6th of October 2020. We've touched upon the wide membership of that group and co-production. Do you feel you were given the freedom by the Welsh Government to genuinely produce something that had been co-produced?
Yes.
I want to now talk about the report itself, please, but before we bring it up on screen, Jane Hutt made a statement on the 1st of December 2020. If we can have that on screen, please, INQ 000350691, and this was to mark the International Day of Disabled People. And on page 2, please, and at the bottom, since 2002, the Welsh Government has adopted the social model of disability, a model that recognises that people with impairments are in fact disabled by the actions of our society and not by their impairments. So before we look to the report, can you please just explain that model?
Yes, there are two sort of dominant models in disability studies and the disability rights movement. There's the medical model and the social model of disability. And the medical model of disability has tended to dominate in society more generally, but also in things like government discourse. And the medical model defines people by, in a sense, by what's wrong with them, what's different about them, but different is often portrayed as a deficit. So it's quite negative in its approach, and it's also related to a kind of charity model of disability as well. The social model of disability was developed, and it's sometimes called the individual model of disability. And it says that instead of focusing on somebody's medical condition or impairment, and by implication, what's wrong with them, we should be focusing on the barriers in society, the much wider barriers in society that do not allow people with impairments, i.e. disabled people, to function as others can and access what everybody else can in society. So in that respect, you put the onus back onto society and decisions within society as to whether you disable somebody or not. So the idea is that somebody isn't necessarily disabled by their impairment. They are usually disabled by the inability of society to accommodate that impairment.
On that note then, can we please turn to the locked out report INQ 000142176, page 18, please. And it's the last paragraph on that page. And we can see here it says evidence we present in this report suggests politicians, policymakers and professionals have hastily reverted to using a discredited medical model of disability. And so was the finding that the Welsh Government, contrary to what Jane Hutt may have said, that they were not adhering to the social model but had adopted a medical model?
Yes, I think that all governments did in the UK initially react by adopting a medical model, yes.
In terms of what that meant for disabled people living in Wales throughout the pandemic. What did it mean for them in terms of how the Welsh Government used this model to make its decisions?
Well, I mean, it meant that apart from the Disability Equality Forum, that disabled people were not seen as a group that was going to, needed to be consulted. I mean, one of the things that the Locked Out report continually says is that if we had a society in which disabled people were adequately represented as decision makers in all aspects of our lives, including political decision making, then perhaps some of the problems with the pandemic that disabled people experience wouldn't have happened in the first place, because they would have been around the table. They wouldn't have been seen as a special group. They would have been actually integrated into decision making. And perhaps we wish that some of the decisions that had been taken may have been better informed. This included things like, the wearing of face masks, which disadvantaged people with hearing impairments, the social distancing regulations, which were problematic for people with visual impairments, and the locking up of quite a lot of people with learning disabilities, particularly those who are residential in institutions, and really the removal of their right to independent living and their human rights.
I want to come on to a number of those topics, but just before we do, since the publication of this report, have you seen a change, or did you see a change in the attitude of the Welsh Government?
Yes. I think the thing is that the Welsh Government adopted the social model of disability quite some time ago, but our argument has been that that is not reflected in their legislation. So there are a number of relevant pieces of legislation that have been passed that I'm trying to remember, Social Services and Care Act. I can't actually remember the name of it. But there are a number of pieces of legislation that have been passed which do not use social model language. They use medical model language, and they define disabled people in relation to their medical condition. In relation to what's happened since that statement and since the report, we've had a Disability Rights Task Force, and with that, Welsh Government implemented something we recommended in the Locked Out report, that participants all undergo social model training. And that social model training is contracted out to a disabled persons organisation. In this case, it's been Disability Wales. And everyone that's participated in the task force, including ministers and officials, have been asked to undertake social model training, which has been made available to them. I don't think it's compulsory, but it has been made available to them.
Can we then come back to some of the other points that you've just touched on, please? And one finding of the report was that there was a poor public understanding that some disabled people would be unable to comply with certain MPIs, and you gave some examples, socially distancing and face coverings being just two.
Yeah.
And of course, this meant that there were occasions where disabled people were challenged by members of the public, and unfortunately in some cases maybe abused by members of the public. Did you find any evidence that the Welsh Government had actively considered that might be a consequence of these MPIs?
That's quite difficult to answer because I wasn't having conversations with officials and ministers at the time. So it would all be secondhand through, what people in the steering group were saying had happened, rather than because I didn't have that conduit in terms of having a direct line to discuss this with a specific official or minister.
Perhaps a question you may be able to help us with is, do you think that there would have been ways to mitigate this? For example, better public health communications?
Yes. I do, and I think the Welsh Government did discuss this in the Disability Equality Forum, and there were attempts made to address these issues. I am going to, for the record, say that Jane Hutt was excellent throughout the proceedings, that, from what my experience of her. She does understand the social models, and I think Mark Drakeford also understands the social model of disability. I wouldn't say that all Welsh Government officials do, and I haven't really had enough conversations with other ministers to know. But I think that what worries me is that that means that understanding of some of these really basic issues that should have been understood really quite early on are down to one or two people. They may have been very influential, and they may have been key politicians, but they couldn't be everywhere all the time. So I think we're talking about a whole culture that needs to be changed, and that takes a huge amount of time. It's something that we're trying to work on with the Disability Rights Task Force. But, if we're looking forward rather than back, we would hope that some of the work we've done subsequently with Welsh Government would mean that these issues would be more to the fore of their minds than they were at the start of this pandemic.
Can we then move on, and if we can please have INQ 000142-176 back on the screen, this time at page 22. And a topic considered in the report is the human rights of disabled people. And there's one specific example I wanted to ask you about, which is the last paragraph. You'll be, I'm sure, very, very familiar. What was the issue that was being raised here, please?
The issue was that, I'm not an expert on the Coronavirus Act, Commencement Number 1, Wales Regulations 2020, but people did bring a number of concerns to the group that there was uneven access to services, and dependent on where you lived in Wales, that there was concern about certain protections being withdrawn, and that people were being neglected, particularly people receiving social care in their house on an individual basis, that there was a risk of abuse, and that Disability Wales had raised this with Welsh Government, and we were concerned that there had been a very slow response.
And as you've just acknowledged, Jane Hutt engaged well throughout the pandemic, and indeed you say that this particular issue about the suspension of this provision was raised with Jane Hutt, who committed to resolving the problem. And I think you've just touched upon this, but was that done quickly enough?
I don't feel I'm very well informed on this, but from what people were telling me, no, it wasn't. But, I think there are people who are better informed than I am to be able to pass a judgment.
Right, thank you. Can we then please turn to page 29? And it's the second to last paragraph. And a statistic I think we've already heard a number of times so far in this inquiry, but equally alarming every time, is that data published in September 2020 shows that in the period March to July, 68%, or almost 7 in every 10 COVID deaths, related deaths in Wales were disabled people.
Yeah.
As far as you are concerned, was there ever a feeling amongst the group and those that you spoke to that the Welsh Government had seen this as inevitable?
That's a difficult question. No, but I want to caveat that in that I think that there was more of a culture of inevitability coming down from the UK government around the whole discourse of people who were vulnerable because they had pre-existing health conditions. There was a feeling amongst the group that disabled people were generally seen throughout COVID as dispensable, that it was almost inevitable that because they had pre-existing health conditions, they would be more vulnerable to COVID and therefore they would die. And I know when this statistic came out, it was really quite shocking. And I remember the meeting that it was brought to. The statistician from Welsh Government brought the statistic to the meeting. And there was a lot of discussion about why might it be so high. And latterly, we learnt that it was particularly high in Wales. And I think that that has a lot to do with the historical and socioeconomic profile in Wales of poverty and deprivation. And, you know, I just feel that what we wanted to convey in the locked out report was a really clear message that it was not inevitable that disabled people were necessarily going to die in larger numbers than other groups of the population. There were things that could and should be done, and there were lessons to be learned for the future.
Perhaps on that same topic, page 34 of the report, if we could have that, please. And it's the top paragraph. Concerns have been raised about the access of long-term users of NHS services for non-COVID related health conditions in Wales. So perhaps directly relevant to what we were just talking about. While suffering from the direct harm of the virus itself, disabled people were also suffering as a result of reduced access to non-COVID services. And in your view, is that something that was avoidable?
I mean, I'm not a medic and I wasn't working in the health service at the time, but I think that a decision should have been taken about the maintenance of some non-COVID services, particularly rehabilitation services, that were completely shut down from what we could gather. This example here is Fight for Sight, and there was Andrea who came along from I was going to say blind dogs, because she always calls it blind dogs.
Blind dogs for the blind?
That's it, guide dogs for the blind. She always calls it blind dogs, so it's kind of stuck in my head. And she's sight impaired, and she continually brought up the issue of people not being allowed to go to rehabilitative appointments, and the fact that a number of people that she was aware of had actually lost their sight completely as a consequence of that. So these were essential appointments and essential medical interventions, but they were not about COVID. Yeah.
Finally, then, on the report, please, can we please look at page 27 and the fourth paragraph from the bottom. This is in respect of equality impact assessments, more of which to come, but the use of equality impact assessments as an available tool during the pandemic have been conspicuously absent. We call on the Welsh Government to ensure that EIAs are properly used and are not just consultation exercise, but opportunities to genuinely co-produce action plans and evaluations with people and people with other protected characteristics. And so first of all, you say they were absent in the report. Mm-hmm. What's the importance of those impact assessments being undertaken?
Well, I think had they been undertaken, some of the issues that we raised in the report would have been discovered and they would have been apparent. The whole point of equality impact assessments is to ensure that you consult with the groups with protected characteristics that the Equality Act specifies. And I think that increasingly, equality impact assessments over time have just become a bit of a tick box exercise. And there's been evidence of this. Even the Equality and Human Rights Commission, I think, have reported that equality impact assessments have lost some of their importance. And I think that they shouldn't just be consultation exercises, but originally, because I remember taking part in the very first equality impact assessments in the public sector as a disabled person myself within the university. And originally, there were some really, in-depth consultation exercises with staff and key personnel with protected characteristics, but they've become much more diluted in recent years.
Can we then please move on to the publication of the report? And it's right that a meeting took place between members of the steering group with the First Minister, Mark Drakeford, on the 18th of March 2021. Can you recall, is that the first time that the group had met with the First Minister in respect of the report?
Yes, it was.
Was that quickly enough?
No, well, we waited some time before the meeting, and we had a period of time in which we, to be quite honest, we thought perhaps we'd been forgotten completely. Either that or the report was too honest and too hard-hitting that Welsh Government didn't know what to do with it. Now, both of those are speculations because we have no idea what was going on behind the scenes. But it didn't feel quick enough, no.
But in terms of the publication, there was a delay?
Yes, there was a delay.
And do you feel you've ever been offered a reason for that?
Not a proper explanation, no.
The Welsh Government, on the same day that they published the report, which was the 2nd of July 2021, they also published their response to the report, which I won't ask you to look at now. But it's right that one of the things the First Minister committed to was establishing a task force. And if we can turn then, please, to the Disability Rights Task Force. To what extent did the steering group, who had been involved throughout production of the report, influence the approach that would be taken by the task force?
Yes, well, originally, we thought we were being asked to put forward some terms of reference for the task force. And we did have discussions as a steering group about that. And we did make some suggestions. But after a number of meetings, we felt that the vision that we had was a little bit more developed and possibly more ambitious than the vision that Welsh Government had. And there was a little bit of conflict backwards and forwards as to what they saw this Disability Rights Task Force wanting to achieve. I felt that the steering group had a very clear vision of what it wanted to achieve, which was that it wanted to take the recommendations from the Locked Out report and the chapters within the Locked Out report and really interrogate those in much greater depth and any other issues that we weren't able to cover because the original report was written in quite a short period of time. I think it was about 3 or 4 months. And so we were also aware that we hadn't covered some issues, for example, education, children and young people, justice, in any great depth.
And so were there any tensions between the Welsh Government and the steering group that you can recall?
Yes, there were. And there were a lot of conversations amongst the steering group. We had a number of online meetings saying, where do we go from here? What do we do? What if they don't publish it? We've done all this work and will anyone ever see it? This kind of thing. And I think there was a feeling within the steering group also that if Welsh Government didn't publish it, then we would publish it independently.
And so the task force was formally constituted in November 2020.
Mr. Paisley, I'm sorry to interrupt. Are you going on to a slightly different topic?
My lady, I have one final question on this topic, then it might be a convenient moment.
Are you okay to come back this afternoon?
Yes.
I'm sorry, just something's arisen that we need to sort out over lunch, so I suppose you could just deal with this last matter and then...
Okay.
Just in respect then of the task force being constituted in November 2021, it's right you're the co-chair
Yes, I am.
of the task force. And just generally speaking, do you believe engagement with Welsh Government officials on the task force has been open and constructive?
It's been really good, yes, it's been excellent.
My lady, I would then be moving on to a new topic.
Should have interrupted when I did, should I? Thank you very much indeed. If you could be back for 1:45, please.
Ah, right, okay.
Thank you. All rise.